Well, it is a popular pastime in our area in the summer and the fall. A lot of people like to get out and ride their ATVs.
Sure, we got a lot of great trail systems in the area, and it's a very popular thing to do around here. But they can be really dangerous, especially if you're not wearing the proper protective equipment or you're not using them properly. So we've got Dr. Arrington Thompson, Director of Trauma for Marshall Health Network, to tell us some ways to stay safe. And Doctor, I was telling you, if you type into any search engine and you type in ATV crashes, it's one right after another, headline after headline, about people being seriously hurt. And you said especially during the summer months when it's warmer and people are outside, you see more.
It's almost a law here that everybody should have an ATV, so everybody should know about the safety with ATVs. We see over 350 patients between St. Mary's and Cabell a year that have been injured in ATVs. A lot of them have head injuries, chest injuries. A lot of broken bones. So need to be safe.
Is it mostly children?
No, it's not mostly children. It's mostly adults. But we do see a fair number of children. Children, unfortunately, unsupervised, which just kind of breaks my heart.
Oh yeah, definitely.
And do you notice that a lot of the patients maybe aren't wearing protective equipment that could have prevented something like that?
So the thing is, protective equipment is clearly necessary. You should be wearing a helmet. You should be, if it's a child, you should be on an ATV that actually fits your size. You have to remember that I'm old, so ATVs, when I was young, you could outrun them. Now you can't. Right? Now they're really fast, they're really powerful. So you have to remember they're not toys, and you need to be safe. The other thing is that we see a lot of intoxication.
That does
Those
not
two things don't
go
mix.
well at all. And I'm seeing your list there of protective gear. In addition to the helmet, that means long sleeves, pants, boots, gloves. It's not just go out there in your, shorts and flip-flops and no helmet.
That's exactly right. And the other thing you need to remember is that these ATVs should not be on the streets because drivers just cannot see you. And unfortunately, that happens all too often, where an ATV will get on the street and all of a sudden you can't be seen. You get hit by a car.
Especially after hours when it gets darker too.
No doubt about it. Big time.
When I think everything that you have said is critical, but to your point, sometimes I feel like people climb on them and maybe have not familiarized themselves with the way to operate it. What do you tend to notice with ATV crashes? Is it that people are thrown from them? Are they rolling on them? I mean, do you see?
We see both.
You see both? Okay.
We see both. We see both. And I think the key is, one, there are safety courses that can be taken. And so there are those people who just don't understand how to work them that get into crashes. But the people that I see by far are those who are out late. They're with their buddies, and they've been drinking or indulging in other substances, which
impairs your judgment.
Impairs their judgment. Yes, ma'am.
Any other reminders? Because you've talked about, okay, be familiar with, maybe take a safety course, wear the protective gear, watch where you're doing. Are there any other things you as a physician who sees when they come in and they've had a horrible accident, what do you always like to tell people?
Well, the first thing is that for kids, the American Academy of Pediatrics actually suggests that anybody less than 16 probably should not be on an ATV, which is a shock to most of our listeners. But when you think about it, you need judgment, right? These things are going fast, and you need judgment, so that's one of the things that they can do. And then again, take the safety course. I think that would be very, very important. And then the other thing is understand that these are powerful, fast machines. Do not drink and drive.
It's a great message.
The other thing too that we've seen as we've reported, a lot of times people are out in very rural, wooded areas, and sometimes it's difficult for emergency crews to get to them. So then with a delayed response time,
that adds on to the problem.
It adds to the time of treatment, just trying to locate a patient. So these are all critical things. Thank you so much for sharing with us, because as you said, there are so many people that do this as a pastime, have it as a hobby, or have one sitting around the house, and the days are going to warm up again, so I think everybody's going to be out there. So this was a great conversation.
Yes. Enjoyed being here.
Yes, we don't want you in the ER, and we don't want to be reporting on you as breaking news either. So have fun, but be safe about it.
Yes, Doctor, thank you so much.
Thank you.